In this video, we're going to be talking about injectable skin boosters. So a lot of patients come through the doors complaining about fine lines and sometimes even deeper lines across the lower half of their face and of course the upper half of the face. The upper half is classically treated with toxin and anti-wrinkle injections, but a lot of patients are surprised to hear that actually there's a few other treatments that you can do before you even delve into the realm of Botox.
So in a previous video, we've discussed the 5 different layers of tissue that you've got within your face, which is basically going from your bone to your deep fat, to your muscle, to your superficial fat, and finally to your skin. So with lots of patients who we see, let's say someone who's in their 30s to 40s, who's starting to notice some fine lines on their lower face or their mid-face, and they're bothered by this, quite often the starting point that we would have would be to restore the volume that they've lost in a deeper plane. So like we've said before, the bone and the deep fat are areas of volume that typically start to go in over time, and that's what causes a face shape to change, and it causes some of the recognisable patterns of aging that people start to notice within their 30s to 40s. So one little demonstration I always like to give people is using a sheet of paper. If we think of anyone's face as this sheet of paper, and over time you start to lose a bit of volume. So my dramatic illustration of volume loss is going to be in here, where our patient has lost a bit of volume. Then we can come in with a little bit of filler, which adds structure just to restore. So the aim of that is to almost re-inflate the paper and restore it back to the way that it was previously before. Not change or enhance, but just restore. Having said that, some of these lines and creases within the paper itself actually stay because the skin is used to being in a certain way. And this is really where skin boosters can be a really useful option to try and turn this piece of paper from this into something a little bit more like this, how it was previously. So when it comes to skin boosters, broadly speaking, there are 2 different types that we like to use in clinic, and they're quite patient specific for which option we would go for. So on the one hand, we've got something like Profilo, which we've done a video on previously and covered in a lot of detail, and it's a really popular treatment. With Profilo, it's really good for targeting fine lines, targeting hydration, skin laxity. It gives a little bit of a lift, and it's a really, really nice treatment plan for people who start to notice a little bit of crepiness within their skin, and they'll start to feel the snapback and elasticity return to their skin, which is great. The next option that we're going to talk about a little bit more today is Redensity 1, and the chemistry between the two and what makes them a little bit different. So with Redensity 1, it's by a brand called Teoxane, which we really like. We use it for lots of other treatment areas that we've previously discussed within different videos, but the main difference between Redensity 1 and Profilo is going to be the added cocktail of ingredients that we find within Redensity 1 that we don't have in Profilo that can offer your skin even more benefits.
So this cocktail of ingredients includes amino acids, antioxidants, minerals and vitamin B6, each of which we're going to go through in a bit more detail in how it helps the skin stimulate collagen. Also, all of these things will then have a 3-fold benefit on the skin. So number 1, restructuring and cell regeneration. Number 2, antioxidant protection. And number 3, skin hydration. So let's break all of these down. So for restructuring and cell regeneration, Redensity 1 can actually increase specifically collagen type 5 in your skin by 98% if you do the full treatment plan. So with the amino acids in the actual complex of ingredients, that actually helps stimulate collagen production. The hyaluronic acid within the product as well stimulates collagen, but also it will help stimulate more hyaluronic acid of your own intrinsically in your skin. Then the minerals and the vitamins will help with increasing your skin cell turnover, because what they're actually doing is stimulating DNA synthesis. So the second benefit, the antioxidant benefit, is really important. It actually reduces oxidation on the skin by 28%. This is really important because especially if you're living in a heavily polluted city like London, Manchester, whatever, or if you are out in the sun quite a lot, which a lot of us have been over the summer, then this can actually add a lot of oxidization onto the skin. So the ingredients like the antioxidants like glutathione within Redensity 1 will actually help reduce that level of oxidization on your skin. And interestingly, the high molecular weight of the hyaluronic acid within the Redensity 1 also has antioxidant effects. So number 3 is skin hydration. This is a really super noticeable difference patients see pretty much straight away. And this is because the Redensity 1 will stimulate something called GAG, or glycosaminoglycans, in our skin. And this is what really attracts and holds water. And what the Redensity 1 will do is increase that by 14-fold. So you're getting the hyaluronic acid in the skin and also the stimulation of these GAGs, which will help draw more water to the skin, making it look nice and more hydrated. And then one of the amino acids called arginine, that's in the cocktail of ingredients that we were describing, actually also protects the sort of upper layer of the skin and prevents transdermal water loss, which basically just means it holds on to the water and the hydration that you've already got into your skin longer.
So going back to one of the big questions earlier of comparing Redensity 1 with Profhilo, I wouldn't say one is better than the other. They're both a little bit different, and in certain patients one might be better for that patient than another. So with regards to Profhilo, because of the chemistry of the product, it's got more potential for a little bit more of a lifting effect, which can be really, really good. Having said that, with Redensity 1, because of this cocktail of ingredients that we've discussed, it can do a little bit more for the overall skin texture. So for things like scarring, for things like a little bit of pigmentation, it can try and improve as well. So there are added benefits to the Redensity 1 that the Profhilo doesn't have, and likewise there are some added benefits with Profhilo that Redensity 1 doesn't have.
We generally sometimes do, when we're picking whether Profhilo is better or Redensity 1 is better, Redensity 1 can sometimes be a bit more of a targeted skin booster. So sometimes people only really have an issue with, say, the deep lines here, which no amount of filler is going to fill, because like what Sanjay described earlier with the paper analogy, once you've got that crease on the skin, no amount of structural rejuvenation with fillers is going to fix that. You need something that's going to target the skin. So rather than needing to use Profhilo, which targets the whole face, you can use a small amount of Redensity 1, specifically targeting your problem area.
So in terms of the treatment protocols for this, obviously the first thing to do is always have a consultation, but if you're looking to plan this treatment for a big event or a certain occasion and you want to know about time frames, typically with something like Redensity 1, the downtime is quite small. So on the day and for about 24 hours afterwards, you're going to have all these little dots on your face which will fade away.
They look a little bit like you've sort of been in some, like caught in some nettles, or you've had a few little wasp stings or something.
Yeah, it's definitely noticeable and looks a bit strange for 24 hours, but it's not for a long time, which is good. 24 to 48 hours or so. And typically with the Redensity 1, we would want to do 3 treatment courses 3 weeks apart. So in terms of planning for it, we need to give it a good couple of months before any big event or any particular occasion that you want to optimize your skin for. Likewise with Profhilo, it's going to be more like 2 to 3 courses, again about 2 to 6 weeks apart. So there is variation and variability in how we go ahead with the protocol, but usually speaking with these treatments we want to give it a good 2 to 3 months before any big event, if you've got something in mind. So in conclusion, Redensity 1 is a fantastic treatment option for people who are concerned with fine lines, elasticity, hydration. It can also impact and improve a bit of scarring, it can target a bit of pigmentation, and overall it just improves your skin and redensifies it, hence the name Redensity 1.
And it is suitable for absolutely anyone. It's not an age-specific treatment, and if it's also a good preventative option as well. We actually start losing collagen in our skin from the age of 25, so maintaining that with a skin booster is becoming a more and more popular option. So if you enjoyed that video, then please let us know, and if you have any other questions or want us to do videos on anything else that is a sort of burning question for you, then please do let us know as well.
Thank you.